So the Center for Data Science and Public Policy and the Chicago Department of Public Health have been in a 5-year partnership to work on the problem of reducing childhood lead poisoning. So I'm the latest data scientist to be passed the baton on this project, but much of the work I'm going to be talking about has been done by the people behind me. So in 2013, after the first DSSG, the Chicago Department of Public Health reached out to us about a partnership where they were interested in exploring how they could leverage their data to deploy their services more effectively. We weren't that well known at the time, so they thought our name was DSFSG. So they had come up with 6 projects that they were interested in doing, and we decided to do a project around lead. We decided to do the project around lead because it's a project that serves the youngest members of the city of Chicago, infant children. So lead is a toxin, and this led to a nationwide ban on lead-based paint in homes. Most of the housing in the city of Chicago was built before 1978. And what this means is that many homes still have lead-based paint in them. And this is a serious problem for infant children. So when children get to crawling age, they start exploring the world. And the way they do that is they put anything and everything in their mouths. And that includes lead-based flakes. When they do this, they get lead poisoned. And so this can lead to a decrease in IQ points, an increased prevalence of ADHD, and irreversible neurological consequences. So it is one of the goals of the Department of Health to prevent this from happening. The current solution is a purely reactive one. A child gets poisoned, they'll then go to the doctor and get screened for lead. If they're found to have an elevated blood lead level, the parents then call the Department of Public Health. The health department then sends an inspector to the home that then identifies the lead hazard and works with the parents and lead landlord to mitigate that hazard to prevent further poisoning of that child and prevent any future poisonings of children that are going to occupy that home. A major shortcoming of this approach is that you're relying on poisoned children as essentially very effective lead-based paint sensors. So we thought we could do one better. We thought we could leverage the data that the city had through a predictive model and assess the risk of a home having a lead-based paint hazard in it. Then inspectors can then inspect these homes and mitigate these hazards before any children are poisoned. So this led to a 2014 DSSG project where the fellows built a prototype model that assessed the risk of a home having a lead-based hazard in it. After the summer ended, the project continued, and so we moved from predicting homes that had lead-based paint hazards to homes that had children in them that would have lead-based paint hazards. From there, once we had a predictive model, we then designed and executed a pilot study to make sure that the model actually worked. In our pilot study, we found that our proactive-driven inspection was able to identify children that were 3 times more at risk of childhood lead poisoning than random inspection. So after we had designed the model and we knew that it worked through our field trial, we then had to figure out how to operationalize the model. At first, we thought that this would be used as a prioritization tool by the Department of Public Health to prioritize which homes to inspect. We realized we could make the model more actionable by deploying it out into the city. And the way we've done that is through the LeadSafe API. And so we've partnered with clinics and doctors so that they can send the city their data on infant children and expectant mothers. The city will then send back a risk score of the likelihood of a child getting lead poisoning. This risk score is then incorporated in the electronic health record of that patient. This can then be used as a tool by doctors to educate patients about the dangers of lead poisoning and, if necessary, order an inspection by the Department of Public Health. So this work has required a lot of partnerships in the last 5 years, And so we hope in the next 5 years we partner with many more organizations, reduce the problem of childhood lead poisoning, and ultimately protect the children of the city of Chicago. Thank you.